all of you for joining us this evening on the discussion on strengthening India's national air quality and ambient quality standards, or NAAQS as they're often referred to. We have a stellar panel here today. Welcome Dr. Prabhakaran, Dr. Sharma, and Dr. Shah. Thank you so much for joining us and agreeing to share your perspectives with us on standard setting and policy making processes in India. Not a very easy task, but we're really looking forward to the discussion. Well, just a little bit of a background. So the trigger for this discussion really was a newspaper report in August earlier this year, where it was said that the Central Pollution Control Board is now considering revising the NAAQS, which were last revised in 2009, and that IIT Kanpur is already beginning some work on preparing the recommendations that would lead to those revisions. Now, as many of us know, that the standards, the NAAQS form really a crucial part of the regulatory toolbox, as it were, for air quality governance in India. They're the basis for the emission standards for many of the point sources. But more importantly, I think, and particularly for today's discussion, they reflect what we perceive to be an acceptable level of exposure, or what we are willing to expose ourselves in some senses to the pollutants, and how the risk of exposure is then communicated to the public. Therefore, there's a very, very clear public health angle to this whole discussion of standard setting. And this is really what kickstarted the discussion internally for us at the Initiative of Climate, Energy and Environment at CPR. And so we're really keen to look at not only at the standards, but the process through which these standards are being revised. And with the hope that if there are ways in which the process can be strengthened, then perhaps a more ambitious set of standards would be set, which would, of course, likely have much more positive environmental and health outcomes. So I'm really looking forward to today's discussion, and thank you so much for agreeing, our panelists and our participants today. So let me just quickly introduce the star cast, as it were. Dr. Poornima Prabhakaran, she's an additional professor, head environmental health and deputy director at the Center for Environmental Health, Public Health Foundation of India. There she leads a team of nearly 20 researchers and consultants, and they're looking at health issues such as resulting from air pollution, climate change, water sanitation, and hygiene. So thank you so much, Dr. Prabhakaran, for joining us. Dr. Mukesh Sharma, he's a professor of civil engineering at IIT Kanpur. Before joining IIT Kanpur in 1997, he was with the Central Pollution Control Board and was at that time associated with the development of emission and effluent standards and EI studies for nearly 10 years. He works extensively in the area of air quality monitoring, modeling and management, exposure assessment, parameter estimation, and simulation. Thank you, Dr. Sharma, for being here with us. And Dr. Ajay Shah, he's a research professor of business at the Jindal Global Business School. He has held positions at Center for Monitoring Indian Economy, Indira Gandhi Institute for Development Research, Department of Economic Affairs, and the National Institute for Public Finance and Policy. His research lies at the intersection of economics, law, and public administration, and his focus areas are macroeconomics, finance, health, and technology policy. Welcome, Dr. Shah. So before we kind of go into the panel discussion, I'm actually going to invite my colleague, Dr. Bhargav Krishna. He's written a framing paper on this very issue on the NAAQS and strengthening of the process. And we really hope that this framing note will serve as a starting point for a discussion on the process. Bhargav, now I'll invite you to kind of tell us a little bit about the NAAQS and the likely revision and how you think the process can be strengthened.
Thank you so much, Shabani. I'll just share my screen over here. I hope everybody can see the presentation. Yeah, all right. So thank you so much, Shibani, for the introduction and for the opportunity to present this reframing note, which we've just released. And a link will be available in the chat box for anybody who's interested in reading the paper. And we tweeted about it yesterday as well. Essentially, this is our sort of take on how to go about strengthening this process that is somewhat extemporaneous in the best of times, and is given its sort of importance to the air quality discourse in the country. We thought this is an opportunity to establish some boundaries and some frameworks that would aid in conducting this process more efficiently. So I'm not going to go into the impact of air quality on health or the scale of the problem. These are all things that we know, but let's jump straight into why do ambient air quality standards exist in the first place. They're essentially defining the basis for assessing air quality across the country and defining what are levels of exposure that we consider acceptable for protecting public health. There are standards that are set for PM, for gases, for metals, for hydrocarbons, and other criteria pollutants. And they allow us to essentially determine our pollution control priorities as a nation, and especially including identifying areas that exceed standards. So under the NCAP, for instance, there are cities that are non-attainment cities because they exceed the national ambient air quality standards for annual exposure. And they're important in also regulating key industrial clusters, which may house several different industries. And for particular broad public discourse, they're also used as the basis to communicate health risks to the broader public, either directly through relaying pollutant concentrations, so levels of PM 2.5, PM10, NOx or SOx, or through the sort of composite matrices that are used more widely, such as the air quality index. Now, the NAAQS in India have their origins under the Air Act of 1981, with the last major revision of the air quality standards being done in 2009. The standards are framed by the Central Pollution Control Board, and enforcement responsibility lies with the state boards. The 2009 standards, although there isn't that much information really available publicly on what information was considered, for instance, we do know through sort of conversations with individuals that were involved that they considered background levels of air pollution in their sort of decision-making process around how to define these standards. And at the time that they were set, they were a little bit more lenient than what the WHO considered acceptable levels of exposure, but more broadly in line with interim guidelines that were set by the WHO for developing countries. Now, the WHO air quality guidelines, of course, were revised and released earlier this year, significantly making them stronger than the previous standards. And a result of that is that our NAAQS standards, for example, for PM 2.5 are 8 times higher than what WHO considers safe for 24-hour exposure and 4 times higher for annual exposures. And so there's significant scope here for revising and strengthening our own ambition with regards to our air quality standards. Now, what has changed since 2009 when the standards were last revised? So the first most important thing is that awareness of the negative or harmful effects of air pollution exposure has really entered the mainstream in public discourse, at least in large urban areas. Now, of course, media focus still revolves highly around Delhi and around the issues of stubble burning that occur in winter, but significant progress has been made in at least highlighting the fact that air pollution is harmful to health. There is now greater public demand than ever around the right to clean air, visible through several public interest litigations that have been filed in the Supreme Court and through actions of the National Green Tribunal, and attention now being given to this particular issue at the highest levels of the judiciary through almost weekly hearings of these PILs. There's also a proliferation of new tools to assess air quality. At the time that the previous NAAQS were set, we were reliant primarily on the gold standard gravimetric sensors to try and assess air quality, which are essentially filter-based measurements. Since then, we have had a proliferation of continuous monitors across the country. In Delhi, we have a few dozen now. In most other cities around the country, we have at least 1 or 2. We also have high spatial and temporal resolution satellite models, which are informing us of rural air quality in areas where we don't have monitoring stations. And we have now, through the National Knowledge Network of the NCAP, tested and approved low-cost monitoring devices as well. So IIT Kanpur is also working on one of these devices. And most importantly, with respect to framing these standards around health, is that we've had an extensive addition to the health evidence base. We have not only the larger studies like the global burden of disease estimates, but more importantly, there are a number of local studies which have tried to assess the epidemiological evidence around air quality and how it affects various health effects. So whether it be cardiovascular disease, respiratory illnesses, or even premature mortality associated with short-term exposures. There's a number of new studies that have come out in the last decade or so, which have expanded the health evidence base significantly. Now, as Shibani noted, the latest revision of the NAAQS were announced by the CPCB in August 2021, although we haven't necessarily seen the actual notification. All the information that we've gleaned are from news reports. The new standards are set to come into force in 2022, with a year essentially for the committee to revise these standards. As per the news reports, the committee has been tasked with revising the standards for criteria air pollutants, determining the effects of pollutants on health and vegetation, guidance on designing and setting up of monitoring networks, and of course, reviewing the air quality index through which risk is communicated to the broader public. Now, this wide-ranging remit is really unprecedented in some ways, and it's exciting to see that there are so many aspects that are being fed into the revision of the NAAQS themselves. As we heard from representatives of the Ministry of Environment in a webinar a few months ago, NEERI is also the National Environmental Energy Engineering and Research Institute in Nagpur is conducting a study to assess the background levels of air pollution that will inform these discussions around the new NAAQS. And these background levels are essentially being assessed by studying the COVID-19 lockdown period as a baseline to try and understand what absence of various sources would contribute to as background levels. Now, whether that is an appropriate background or not is something that can be discussed, given that even during the lockdown, most cities did not really meet the national ambient air quality standards, but that's something that we can say for a separate discussion. Now, why does this process matter? Now, given that these are the standards that will define discourse around air quality for the next decade or so, we are really talking about how we go about defining what is a poor or a good air quality day, for instance, or what levels of air pollution do we consider safe for vulnerable populations like children or those with pre-existing respiratory cardiovascular conditions. They also will provide a basis for regulating certain point sources and industrial clusters. So the definition of what is a severely or critically polluted area could potentially change as a result of strengthening or making more ambitious the national ambient air quality standards, which could potentially have implications on functioning of industrial clusters. They'll also, of course, serve as a benchmark for measuring future progress. So the NCAP, the National Clean Air Program, set a target of 20 to 30% reduction in ambient air quality levels from 2017 baseline. Would this reduction really be meaningful if we end up making significant changes and making more ambitious our national ambient air quality standards, or should we be really more ambitious in our reduction targets? Now, from our perspective, strengthening this process has several benefits, and there are sort of fundamental principles that need to be considered as we engender institutional change with relation to this process. So the four principles that we've thought about as relevant to this process are: first, centering health in air quality policymaking. Second is basing all these policy decisions around air quality on a solid foundation of science by engaging a broader range of experts than are currently being engaged with. Ensuring the relevance of these standards by committing to predefined and periodic reviews, and building trust with civil society and other stakeholders. I'll go into these in a little bit of detail, but just wanted to highlight, of course, as Shibani mentioned earlier, that this note is really an attempt to start a discussion on how the process can be strengthened and isn't necessarily the final word on how we believe it should be done. So when we talk about integrating health in policy making around environmental issues, I think this is a sort of term that's thrown about quite loosely and without really trying to understand how we do that more systematically. And I think the rationale for why you integrate health in environmental policy making is, of course, the laws really exist for the fundamental purpose of protecting public health. That's really why they're there. Yet health science or epidemiology, and not just medicine, are conspicuous by their absence in committees that debate environmental or air quality policy. So I stress specifically on the issues of on the disciplines of health science or epidemiology, as physicians generally, present company accepted, of course, are not necessarily trained in the statistical or epidemiological skills that are required to conduct, interpret, and analyze health studies. And this is where specialist expertise would add a tremendous value. So, for instance, understanding and integrating the latest health evidence, as is within the remit of the committee, is really essential to protect public health. But who would actually interpret this evidence better than somebody who's actually conducted these studies? How would they interpret exposure response curves? How would they interpret impact on DALYs and mortality numbers? These are all sort of important questions that need to be answered. There's also a substantial growth in the health evidence, of course, and understanding, interpreting, and utilizing the best available evidence from all of the studies that have been conducted is something that is relevant with epidemiological expertise as well. And as we've seen over the last week, there's sort of fundamental misinterpretations of the science when it comes to air quality and health, as we've seen with responses by the Ministry of Environment in Parliament as well. And so engagement of experts who are engaged in the conduct of the study would ensure that these fundamental misinterpretations of the science are really avoided. The second aspect around a comprehensive science review is really that global best practice, whether it be the US EPA, the EU, or any other nation or a large body that is conducting this kind of revision of standards, dictates that a comprehensive science review is conducted that documents the best available evidence on air quality and health. And this kind of review is really conducted by an interdisciplinary panel that comprises experts from engineering, atmospheric science, epidemiology, social science, and public policy. And I think the idea behind this interdisciplinary panel of experts is that they bring a diverse set of perspectives around not just the technical aspects of setting air quality standards, but around the social and economic and environmental, broader aspects of air quality policy. We currently do not know really what science is considered in defining our standards, since these reports aren't really made public. But conducting such a review and making public the findings that are arrived at as a result of this review to the public is a means of communicating the rationale for decision making as well to the public. Establishing such a panel would be a new task that would be under the remit of the Central Pollution Control Board. But this kind of panel can also function on an ongoing basis through the interim period between various revisions to ensure that there is an up-to-date understanding of the latest evidence. The interdisciplinary nature of the panel would also reflect the fact that air pollution is not a single domain issue. It's a multifactorial, complex subject that needs expertise from across different sectors if we really want to address it. The third is around ensuring the periodicity of the process. So the NAAQS were first established in 82, they were revised in 94, 98, and 2009. So there's no real clear guidelines on when and how they should be revised and what time period is really considered as an appropriate period for revision. Now, most global agencies or national agencies consider a 5 or 10 year interval as an appropriate time frame to evaluate progress that has been made in the interim and revise and review and perhaps strengthen their air quality standards. And establishing this kind of periodicity ensures that there is some structure that is provided to the other suggested changes as well that could be integrated into the process. For example, the science review could be an ongoing aspect and not just something that happens in a very constrained period of time, a few months before new standards are meant to be published. It could be a 3, 4, 5 year process where there's a comprehensive science review followed by a policy assessment as well that's done by experts engaged by the Central Pollution Control Board. And so ensuring this periodicity means that you have a longer time frame and a ramp up period before new standards are released. You have the ability to engage external experts for a much longer period, glean their expertise through a much more comprehensive engagement process. And it provides government and civil society as well an opportunity to evaluate how we progress based on our previous standards as well. The last principle that I want to focus on is building public trust. And I think the key here is that public awareness of air quality has grown by leaps and bounds since 2009, and there is a greater demand than ever for action on air pollution. Transparency in decision making is really key, as we've seen with sort of ad hoc decisions that have been taken by either the court or by governments. For example, the installation of smog towers, for instance. There is really no rational basis in science, nor is there a sort of broad public demand for installing these sort of expensive boondoggles. And ensuring that there is transparency in decision making would mean that there's a sort of greater trust engendered between the public and experts, as well as the government who are engaged in this review process. This could be engendered through release of key documents, including science reviews, policy summaries, and meeting minutes throughout the period of the process. So we recognize, of course, that a lot of these changes will take a long time, and institutional reform is a long-term process. And so some of these changes that we suggested in our framing note would be something that could be implemented over a longer-term period. But of course, alongside this, we have also suggested a series of immediate steps that can be taken by the committee itself. And I've listed just a few here. So inviting a diverse group of experts, engaging in the science review, developing a summary for policymakers, and in newly instituting a public consultation period would be sort of some of the first steps that a committee which has already been set up would take without necessarily expanding or moving beyond the bounds of its remit. With that, I'll stop at this point and hand over to you again.
Thanks so much, Bhargav. That was fascinating. And we've put up the link for the note in our chat box for those of you who want to download that and look at it. So if I could now turn to our panelists and request them to kind of reflect on some of the key points that Bhargav has raised in the note. So for about 5 minutes each. And so if we could begin with you, Dr. Sharma, and what reflections.
Yes, thank you very much for this important, the panel discussion and the issue that have been brought up. See, first of all, I mean, Krishna's point, I mean, all those things that you have presented, I think if we, not only me, but the others have sort of heard over your talk, I mean, there's nothing to disagree to, frankly, to start with, actually. You raised very important points and how to go about it, how to involve a larger group of the people. And then, that would help in, not only the transparency, but we'll get the right numbers, actually, frankly speaking. That is the key point. And as you have said, that the standards are the key, is basically foundation stone on which the entire pollution control structure is built up, actually. So that is the point, but we are also happy that at least CPCB has taken the initiative to revise these standards, because we have certain experience. We are much better off in terms of understanding of the issues, much better off in terms of what we have learned since 2009. The technology has changed. And interesting, the point is, for this very purpose, when I was sort of presenting the similar thing to CPCB, when they asked me to do a presentation, so we did analyze it, what kind of papers, research have been published onto the air quality exposure and the public health kind of thing. And then we found out that in the last about 8 to 9 years, over 100,000 papers have been published in the peer-reviewed journals, actually. So the information, knowledge, understanding has enormously grown, and since what we probably knew in 2009. So that knowledge is now much bigger. And then issues that you raised, that, what kind of dose response in terms of the weight of evidence that we have talked about is very, very impactful, and that should go into the consideration. That's a beyond doubt, actually. I must also say that you did talk about the previous thing from 2009 and what had happened before. In fact, I too was involved in that very seriously. We did submit a big report. I don't remember, maybe about 250, 300 pages. But I don't know, somehow, for the reasons, let's not go back in the past and, sort of say that why didn't they publish it, or for whatever reason, So that would also give everyone the idea as to what had gone in 2009 and what all the considerations were there. But having said that, I think since now the committee is in place, and we are most probably, we are signing the MOU in a day or so with the with the CPCV, and I can certainly give you a little background as to who all are involved in that so-called committee actually. So of course, myself, my students, and some project staff that would be doing all the background work. We also have a professor from All India Institute of Medical Sciences. We also have a professor from IIT Delhi, and we also have a the scientist from NPL to look after the monitoring techniques and methodology, because that is a very significant part of the air quality standards actually, because how do you monitor so that at least there is uniformity in the procedures, because these numbers, when the moment we talk about these to be standards, it has a legal connotation, and we can't have the very loose ends. Somebody is doing in some fashion, and then the same number, or the air quality could be same air quality could be shown with the different numbers. So these are the background things, and what point I think the take home message from Krishna, your talk, is that, well, the committee may be in place, but I think as the committee progresses the work, and in the intermediate manner, we should have the discussions along with the larger group actually. Not that the committee, at the end of 1 year comes, look, here are these numbers, now let's have a talk. So I think that idea of a larger group or larger participation, that too periodic, that the committee can do the base background work, but then rather than discussing things at the end, but there could be regular interval discussions with the larger stakeholders, and the inputs committee can take these inputs, because there's no point making a document with about 30-40 people coming on the platform, and you are sort of everyone's responsibility is no one's responsibility, that kind of thing we go into. So I think to summarize that, well, that committee and CPCP, since they have the sort of having this MOU, let the committee work, but periodically the committee should, whatever they thinks they are doing certain progress, there should be definite discussions, meeting with a larger group, and we mend our ways on the way, so that at the end, it is a sort of a feedback from multiple people at the multiple stage, and getting the right numbers, so that rest of the things we can, we'll have the right thing to do. And that is what is the procedure. I completely agree with you. And so this is the model that should work perfectly. I think I'll stop there. Thank you. Thank you very much.
Thank you so much, Dr. Sharma. Lot to think about there. And we'll come back to some of these issues in the discussion. And to try and get your views on some of this a little more. Dr. Prabhakaran, if I could invite you now.
Thank you, Shubhani. So hello, everyone. At the outset, I think I want to start by placing on record my appreciation to CPR, Center for Policy Research, and Bhargav in particular for giving me the opportunity to join this panel. Those who know me will know that I'm a very strong advocate for health in all policies. And I think, at every level, it has been my angst that lens is often missed out, and I will share a little anecdote. I had the opportunity not so long ago, a month ago, I think, to be at the COP. And I went knocking on the doors of the Indian delegation, thinking maybe that's where I will get an opportunity to talk to the powers that be. And I did kick off a conversation over there. And I was told, I quote, "You have a very dangerous agenda." So, the conversation that I kickstarted there was about bringing health and bringing the health people into all of the conversations and programs and policy making. And this is what I was told, whatever we do, whatever acts or, programs and policies we are bringing into India is because we are concerned about health. So we don't need to have a separate health agenda because it cuts across all the themes. Well, rightly so. I think health is not negotiable, right? And we know, we're just coming out of this global pandemic, and we know without health, there was nothing, like everything, economic slowdown, the social fabric crumbles. So I think this is a very timely conversation in a way, because the policymakers understand that, yes, it is important to have health framing to what they do. But even closer home, I felt in the last few weeks and months, like when the people who are working around this area, whether it's a convening of climate change activists and researchers, or the air quality people, there's very often there's a missing health voice. So really grateful for this. And I suppose it's probably ingrained in Bhargav's DNA because of his past engagement with PHFI. So thanks Bhargav, more power to you. Hope more of this happens. But, reflections on the paper itself, I think it's a very, very timely discussion to start off. And, the committee is already in place. It's never too late to have this conversation. And I think you bring in 4 very important, pertinent points. And I already talked a little bit about the health framing. It's really important because it is at the center of everything that we do. A good health lens to every program and policy, whether you understand the other conversations or not, people will probably understand it when you bring health into that discourse. So I think the health framing is really important, and you bring it out front and center in your paper and discussion. I think that's important. And I think the evidence base, the second thing that you talk about, you rightly point out that, a decade or so ago, I don't think we had enough of that evidence base in India. And a lot of times we heard the policymakers tell us, you're just telling us there are health impacts of air pollution, but where is the evidence? But things have changed. I think in recent years, we have more and more evidence closer home, whether it's, intuitively, we all think that it's the impacts on respiratory health, but even cardiovascular health. Air pollution impacts cardiovascular health, stroke, adverse pregnancy outcomes, all of that. So I think there is enough evidence now that, action needs to happen. So I think bringing evidence into your policy making is important, and not, once in a decade, rightly pointed out again, Bhargav, by you, 4 decades since the first NAAQS. Every decade you're reframing and revising the standards, but a lot happens in between. And especially so in the last 5 years, the evidence base has really grown by leaps and bounds. So I think it's an important issue that you point out over there as well. And again, the interim review process. It's not easy to just, set up standards, and it's not an easy process, but it's not also right to wait every 10 years to revise it. And there is work that needs to happen in the interim. And whether it's just pulling together the evidence base or, revising, maybe you're going to have some interim standards as well. So I think those are important points that you bring through in your paper. And lastly, the public discourse. It has to be an inclusive process. And I think the consultations that don't happen enough, or they happen at very short notice with a very short time frame. So there's not enough public inputs or public engagement in programs and in the policy making. And I think it's important and pertinent points that you have brought out. And I think I'll stop there, because I think there's enough opportunity that I will bring in more of the health discourse later. So Shibani.
Definitely, Dr. Prabhakaran, we definitely want to hear more from you. Shah, I could invite you now for your reflections.
Sure. I have 6 things that I'd like to say. The first is that it seems to me that air quality in India is very, very bad, is way beyond any normative or legal standards that have been established. So as an outsider in the field, I'm not convinced that making changes to the standards is an important point of pain. Okay, so you need to persuade the reader of the paper that the standards actually matter, because I think we are wildly far from the standards. My second point is that somewhere in all these conversations, there's this little economisty thing that went off in my head, that it is not correct to think about pollution control as some kind of objective numerical values that are determined from the health literature. It is an economics question where you compare the cost of control versus the gains from control. So it's not just health science, it's not just epidemiology, it is dollars per DALY, and you have to bring money into the story. How much does it cost society to bring down pollution, and how much are the gains to society when you bring down pollution based on the statistical value of a life? So this is cruel, but it is true, it is correct. And any attempt to do pollution control that does not grapple with this economics will end up with answers that are just widely going against the grain, and it will not work too well. Third, Somewhere implicit in the conversation today, I saw a lot of use of the word experts. Okay? I have a problem with that. All of us in this room are experts, but in a liberal democracy, we do not aspire for the rule of scientists and engineers. This is a very key point. Liberal democracy is where the people shape the state. The role of experts is to advise the policy process, but the policy process should give power to the people. So we should always manage that line between each of us as experts, where we express our points of view and we try to persuade decision makers, but the decision makers should always be the people, should come from the people, should represent the people, should be closely mated to that trade-off between cost and benefit. There should be people in the room who are having their lives destroyed by air quality. There should be people in the room who are having their lives destroyed by pollution control. And it is that debate, disagreement that will find a middle road that is appropriate for society. So, there is a country where engineers run the country, and it is called China. Okay, the meaning of liberal democracy is that the scientists and engineers do not run the country. So we should be very cautious and have a systematic liberal democratic conception of the place of experts and the place of the people. And we should always put the people first. The people should make these decisions, and our job is to be there in the room and help them make choices. But we cannot substitute for the people. Fourth, I want to show you a concrete example of process design. In the field of monetary policy, there's something called the Monetary Policy Committee. So it's a committee that controls the interest rate that is set by the Reserve Bank. Okay, so in the olden days, officials in a central bank controlled the policy rate. And all over the world, this worked pretty badly because the rule of officials does not work well. And all over the world, this has been broken open into something called the Monetary Policy Committee, which has the people on the committee. Okay, so multiple individuals from all over the country who have skin in the game of monetary policy come together and vote. Okay, so in the MPC experience, in the Monetary Policy Committee experience, what we now know all over the world is it's not a vague job of setting up a committee and saying the committee will decide, because that tends to concentrate power in the hands of a politically powerful or charismatic chairman. Okay, so then it really goes back down to rule of one. What has been done all over the world with great success is that the Monetary Policy Committee votes, and the voting record is released in public, and each person who votes is obliged to give a rational statement of how they voted and why. Okay, so these are the kind of elements of the process that generate a better outcome. That all of us have been in rooms with committees. These are non-transparent, closed rooms, and political power and the wheeling and dealing inside the room tends to shape the outcomes. And the design of the MPC in the field of monetary policy is a nice example of cutting through that through a voting system. So I'm a great admirer of putting in formal voting systems. So you need to think about the composition of the committee. How do you bring the people into the room? You need to think of the work process of the committee. How do experts advise the committee? Then you need a formal voting process. Then you need a transparency system where each person's vote is released into the public domain with a rationale statement. So each individual who is a voting member of the MPC is held accountable by their community outside. That why did you do this? What the hell were you thinking? They have to face their community. They have to face the criticism of their friends and family. It's not just some opaque power that, oh, I went to a committee meeting and we chose this. And in front of their friends and family, they'll say, you know, I didn't really agree, but the bulk of the room was like that. So this is the standard double-faced thing that all of us do in a conventional Indian committee. So we are not accountable to our friends and family. And there is a loss of professional strength that occurs on account of that. So I feel formal thinking on composition, process, and the role of experts is valuable. My fifth point is about decentralization. It is obvious to everybody in this room that Delhi is different from Trivandrum. Okay, so Tamil Nadu and Kerala are like advanced economies. Within 10 years, they will be like Southern European countries. And North India has a horrible place in terms of the atmospheric science and in terms of low income. So it can't be the case that pollution control decisions are made in the same way between very diverse places in the country. Because once again, go back to the beginning where I said, you got to think of the cost of control, you got to think of the benefits of control. In North India, the cost of control is higher. In North India, the benefits of control are lower because of mass poverty. So the efficient decisions of society of what air quality you will tolerate in North India will be much worse than what you will tolerate in Kerala. It also reflects politics, as it should. So the people should choose. And I expect that a representative group in Kerala will choose very differently from a representative group in North India. So I feel we should think in a more decentralized way. We should not think that there is some union or national or one size fits all. Atmospheric science should guide the appropriate geographical units that are relevant for decision making. And as with carbon dioxide, these things don't necessarily fit tidily within a country. So Nepal is adversely affected by the pollution of North India. Pakistan is affected by the pollution made in North India. Pakistan makes pollution for North India. We need to find ways to bring appropriate geographical units as defined through atmospheric science to come together and make these choices. It doesn't make sense to use Westphalian states as the unit of organization. That's just an accident of history. Finally, there was the word public trust that was used. I deeply value that perspective. It's extremely important. And I just want to flag off the crisis of data. We just don't have high quality, trustworthy data. So as an outsider in the field, I feel this field has just begun on producing data that we can trust. I have some work with the CPCB data, and I think that there are huge difficulties in the data as of today. Thank you.
Thank you so much, Dr. Shah. A lot to think about there. And it's really good to have someone, we wouldn't say from outside the community, but who has a different lens to the way we, many of us who've been working on air quality. So it's really useful to have a different perspective from what we are used to hearing and talking about. And it really makes us think a lot more. But before we kind of jump into the discussion, Bhargav, I would, I was wondering if you would like to respond to some of the comments made by the panelists to your paper.
Thanks, Shubhani. Yes, so just thank you all so much for the excellent sort of feedback on the note. And I think it seems to have served its purpose as stirring up a discussion around some of these principles. And I think starting with Dr. Sharma, thank you so much for sort of acknowledging the fact that this process could be perhaps far more open and consultative and engage with a broader set of stakeholders than it currently does. And I think it's heartening to hear from you that this is certainly something that is on your agenda, and is perhaps something that could happen even within the current framework of the committee as it stands. And I think there's sort of a wider benefit also to taking this periodic input. I think there is sort of greater means of accountability also, as Dr. Shah raised, by engaging with stakeholder groups as we go through the process rather than at the end of the process, as you yourself highlighted as well. With Dr. Prabhakaran, of course, I completely agree with almost everything that you said in terms of bringing a health frame to this. And I think the health frame, or how do we operationalize some of those sort of theoretical frameworks that we talk about when it comes to integrating health in broader policy making outside of the health sector, is something that I think requires deeper thought. I think beyond us talking about having a stake in the process or a seat at the table, we need to think more deeply about how do we sort of integrate health more broadly into this decision-making process. And I think that's something that we can discuss as we move forward in this sort of particular dialogue that we're starting. Dr. Shah, I think I don't think there's anything that we really disagree on any of the sort of points that you raised. I think the not being the rule of experts is something that we are actually very much agreed on. I think it may have come off as me highlighting that experts should be more deeply involved with the process, and that experts should lead this process through to its sort of natural conclusion, whatever that may be. But I think the actual aim of sort of articulating this was not to sort of isolate just solely experts as the sort of purveyors of knowledge within this domain, but rather to say that pool of individuals who are engaged within this process must be expanded to a broader stakeholdership, including civil society and sort of public stakeholders who would have a greater understanding of the impacts of some of these exposures. your points on accountability are exceptional, very well taken, of course, and the Monetary Policy Committee may be an interesting sort of example to try and sort of implement over a longer period of time on something like this. On decentralization, the AIR Act actually empowers, and the EP Act actually empowers state pollution control boards to enforce more stringent standards as they require. I mean, the national ambient air quality standards are a sort of minimum standard that is set for the nation, and states can choose whether they want to implement more stringent standards. The reality is, however, that the capacity within these pollution control boards is so poor that most choose not to do anything and consider this the gold standard arbitrarily in some cases. And so I think there's sort of larger discussion to be had later on how do we go about strengthening the boards so that they are actually able to effectively deliver on the tasks that they've been assigned. On the aspect of administrative or geographical boundaries within which we sort of enforce and deliver on sort of broader policy related to air quality, I think Shibani has actually a discussion around that very theme coming up very soon next week. And so that's something that we're actually thinking about more deeply as an institution as well. How do we actually do some of the things that we're talking about at a city level or at an urban level at a broader air shared level, given that air is sort of interconnected across the entire Indo-Gangetic plain, for instance. And so I'll use that as an opportunity to plug the webinar that's coming up next week, Shibani.
Thank you, Bhargav. I was going to end today with that, but that's a great point. Next week, 15th December, on kind of reforming air quality governance in India. But let's now kind of get into the meat and a little more of an discussion now. And we do have some themes that we'd like our panelists to respond to. But people in the audience, if you have more questions, already questions are coming up in the Q&A box. But please feel free to write more in that box, and we'll curate that and put them to our panelists in the end. So one of the questions, so let me start with Dr. Sharma. Dr. Sharma, as you said, you've been part of this process earlier as well. Of course, you were part of CPCB, but even subsequently, you've been part of various government committees and air quality monitoring and various aspects of them, of course, in core part of your work. So I'm wondering if you could tell us, has the process changed over the years? Is there scope for the process to change? Because as you also kind of said that, you had done a lot of work in the last revision as well, and things didn't, it's not available for whatever reasons. But I'm just wondering, with this revision, do you think you can set in motion a different process? What would that require? Whether from the committee or from the CPCB or for those of us from outside would like to support the process in some way.
Yes. There definitely this time the process would be somewhat different, quite significantly different than what was done in 2009. For the first reason is that, well, in the previous one, largely, those who mattered really, they all were engineers basically, So that is one thing. Now we have the different people from at least in the core committee, if you like to call it right now. The people from medical fraternity, from the modelers, and also the expert on the air quality measurements actually. So that is one part that is not so this thing, but I think this time this is going to be even more highly evidence-based and weight of evidence kind of thing, looking at the different dose response curve, just not going purely by the means of looking at the lung parameters and all. Initially the entire focus was how the lung would be affected as a target organ, but I think this time the dose response or exposure response would be very different, because our knowledge is different, and also the mortality component which was rather weak. This time we have the integrated exposure curves, even not only for PM 2.5, we also have these curves, maybe not that well established, but even for the pollutant and composition specific thing is also there. What is in there, PM 2.5. So that part is there. I must also respond to Dr. Shah, because in this document, I don't know the proposal that what we submitted should be public actually, because the way we said that this is how we should proceed, and they sort of in some presentation and all they agreed. They are both the issue of CEA, that is the cost-effective analysis, and cost-benefit analysis would be the component of the outcome before finalizing the standard. So that component is there, and of course the Krishna has responded about the geographical part of it, or the north versus south or the central part of India. The standards are minimum national air quality standards, where the states can sort of make them more stringent if they want, but generally that do not happen, because reason is that, well, the state also thinks the most stringent air quality measures means there will be less, the attraction for the industrial development will be poorer actually, So that these are the other considerations which are there actually. Apart from the cost benefit analysis, this time we are also looking into the what we call as the risk-based analysis, and looking at the risk of the air pollution versus risk of the other individual habits and individual things we encounter every day. So we don't want to also say that, well, absolutely, we have to safeguard everyone from every bit of air pollution issues and problem and risk. But then this has to be compared with what kind of risk that is the other things are posing to us, like rather than having just the absolutely minimum risk. So that would make our stringent, standards very stringent. And then economic issues will come in between. And then also this time we want to break down the things to the emissions which are controllable versus uncontrollable, for example. This is slightly technical in the sense that, well, for example, we have now the understanding is much better. We have the secondary particles or secondary aerosols. Like, for example, a reasonable component of biogenic secondary component. Biogenic is something which is, we say, even if we want to control, we can't control it because those biogenic emissions or natural emissions. So they also have certain impact on the. So that science thing would be very deeply into it. The other thing, before I end, is also in this particular thing, we would be also doing there would be a team of the students, project staff going out to about 10 different cities and collecting the data, because air quality database is reasonable now. So they would also go to the hospitals and try to collect the data as much as they can in terms of, especially first of all, to start with the lung, functions and, admissions versus what kind of people are coming from, what area they are coming, for example. So we have listed 10 different kind of diseases on which we'll collect the data. Because, sometimes what happens is that we do something with sort of a lot of science available internationally, but you'll always be accused of, where is the Indian data? Where is the Indian information? So this is something, although I'm the firm believer, the physiology is the same, the impact will be very, very similar. But then, somebody can just dilute the whole thing by saying that, well, this is something from WHO or XYZ thing. So that information would also be collected this time. And let me also, last point I must share, apart from the traditional parameter criteria pollutant, but there are certain industry specific pollutants are also there, which do not fall into this category of 8 to 10 pollutants. So we also will try to come up with certain guidelines, if not the standards, for the pollutants which are specific to the industry, but they do not fall into the list of these 12 parameters. Just to give you example, for example, fluoride. Actually, fluoride would come in immense quantity and has a lot of health impacts in terms of from the aluminum industry, from the fertilizers, especially the phosphatic fertilizers. So this, in a way, that would also be wished to address as to how would those guidelines would be available, so that we are just, because that kind of issues just can one can escape, because, well, my PM is okay, but suppose the fluoride is high actually. So these are the things that are certainly different than what we thought was done in 2009. But again, having said that, better discussion, larger platform is, of course, is a welcome thing. Thank you.
Thank you, Dr. Sharma. I mean, it certainly sounds like the scientific basis of what all is going to go into the process is going to be much wider than it was the last time. I mean, the question that we all are now wondering is, how the process will roll out. And we do have full faith in you that you'll ensure that the process is also much more consultative and inclusive than last time. Dr. Shah, if I could bring you in here now. So clearly, would you agree that the standard setting process perhaps is technocratic, the standard setting per se, but the implementation or the monitoring or how policies are built around that process, those have to be resolved or prioritized or designed politically. And therefore, I mean, what I'm trying to get at is what you were saying earlier, that, this is, it's not just the experts and we just have to be in the room, but it's actually some form of politics. So do you think we could draw that kind of a distinction that, when we talk about standard setting, yes, we need some technocratic basis, but it's the implementation where the people come in and where we need to empower the people much more.
If the standard is going to be used to guide and shape state coercion, where we will penalize certain kinds of persons using state power, then the creation of the standard is inherently political. And as I said earlier, the heart of the economics of pollution control is that every society has to find the point where there is a level of pollution where the marginal cost of pollution control is equal to the marginal benefit of pollution control. So finding the desired level of pollution is not a technical decision, it is an economic decision. And therefore, it is something that the society has to emerge with. And for example, you will straight away get a rational analysis that as prosperity goes up, the desired level of pollution will go down. And so straight away, you will get variation within the appropriate geographical units. So, I would not push the purely accidental definition of national boundaries or state boundaries. We need to think about atmospheric science to identify the relevant geographical units of area. But in each geographical area, the simple variation of income will ensure that the efficient choice of the desired levels of pollution will vary.
Sorry, if I could just, I'm not an economist and I've heard this, I've read about this, and I'm just curious, isn't one of the, two factors that are perhaps necessary for the efficiency, the way you defined it, to be reached, is one, that there should be information, and therefore, and which is something you pointed out in your initial remarks, the lack of clear data. Yeah. Second, just the voice at the table. So I'm just wondering, with those two factors not being that clearly defined or available.
So, public goods of data is an unambiguous good thing. And the gains to society from better data are just simply vast. And so on that, I have no disagreement at all. And you heard me say that I'm very concerned about the low quality of data in India. That's unambiguous. But then you come to the next question. Okay, fine. We have terrible levels of PM 2.5. By the way, there are many suburbs in Bombay where I have measured PM 2.5 values like 150 and 250. Okay, so on the coast of Bombay, you get values like 0, but you go 10 kilometers inside, you get values like 150 and 250. So there is an air quality crisis all over India. Of course, there is the North Indian heartland, which is just a different level of disaster altogether. So as I said, the economics of this is that society has to weigh the costs and benefits of pollution control, and every day, the technological possibilities for how cost-effective pollution control can be achieved can and will change. And so there has to be a vibrant process that is alive to the changing frontier of possibilities.
So Dr. Prabhakaran, if I could bring you here, as you said in your initial remarks, that you're someone who's always kind of pushed for the health framing to come within all forms of policy making, environmental policy making where it's possible. I'm just curious how would the health framing in this particular, in the NAAQS itself, how do you think it would change the outcome meaningfully? How do you think, if the health scientists or people from your field did get a voice at the table and were included in the process, how do you think the outcome would look? How different would the outcome look?
Thank you, Shubhani. Yes, it's a tough question even for us to answer. But certainly, even with the existing standards, there's always the conversation that we've just heard now about the implementation challenges. And I think if you get health lens into that standard setting itself, there it means that you're bringing into the conversation what are the permissible levels of different pollutants. And I'll give you an example, like, recent research that our group has done, for example. So I was telling you in the beginning, like air pollution is one of the top of the table risk factors for non-communicable disease, heart disease. We hear about respiratory health, and that's intuitively so. But, even for cardiovascular disease, and an intermediate risk factor for cardiovascular disease is hypertension, high blood pressure. So our research shows that in Delhi, in urban Delhi, for example, every 25 micrograms increase in the PM 2.5 causes 3 to 5 millimeters increase in the blood pressure of an individual. And that seems like a small number, but if it translates into this. Basically, if you are going to achieve the national NAAQS for Delhi, you reduce the prevalence of hypertension in the urban Delhi population by 15%. That's massive. If you look at then how much you're translating that into access to healthcare, 15% less of Delhi population needing access to healthcare. So it's across the board, like, it's across the board in this. If you're addressing your upstream determinant, air pollution, you're going to prevent a lot more people reaching the public health system. And we don't want to even start thinking about what the public health infrastructure is. We're just coming out of this pandemic, and it just laid bare, the shortcomings in our health infrastructure and the entire health system. As 1.8% of GDP still spent on health. We are amongst the, the poorest, the health spending that happens in any of the developing countries. So I think the health lens is important because it brings that urgency to the implementation as well. It's one thing about the different levels of pollutants, but it's also the impacts with the pollutants, PM 2.5, PM10, the ultrafine particles, black carbon. The evidence is coming out, the impacts on health are much more. So that also translates into how you're going to address your, the sources, the emission standards for different sources like the power plants. When is that going to happen? The extended deadlines for conforming to the emission standards. So if you bring that health conversation, I think a lot more can happen in terms of outcomes. Otherwise, in terms of implementation, it's just as laid back as it has been all these years. I don't think that urgency comes into the picture at all.
Dr. Sharma, actually, this is a question I think it's also something someone from the audience has also asked. So the question is, well, setting standards is only one part of the regulation of air quality. How does the NAAQS stand alongside monitoring and regulation of emission sources, or are the NAAQS just kind of a checklist for industries? Like how? So NAAQS is just one piece of regulation, or is it part of a much larger puzzle?
Yeah, ideally, the emission reduction is connected to the standard achievement. But if you see the UN government's environmental policy, that's what it says. But I don't think there has been, until recently, there was anything which we tried to have the linkage between the emission to the attainment of air quality. That thing has not happened, but that is what it should happen. But now, of course, as the awareness is better, the courts have intervened. So therefore, now people are asking for the so-called source apportionment, connecting the sources to which source to control, how much to control, what are the options that we have. So that is happening lately, but earlier it didn't happen. Earlier, even the emission standards were sort of thought of to be the industry would be so powerful and they would be the one who will be deciding in all the discussions. And obviously, if they have to spend money, that is the cost and all is more. But now that thing is changing. Let me be very frank. Industries as well as, and we know the reasons. Actually, we might say, well, the power plants are not doing as good, but of course they are on the track. Electrical vehicles on the track. BS6 has arrived. The emission standard for power plants have been made more stringent. So that sense is there now, which source to control, how much to control. For example, even this Ujjwala Yojana, it has very significant impact actually. So these are the things I think that now there are ways and means to connect the things, to build those linkages and to have that causal understanding, and and taking the actions based on those understanding. So that is, I think, is happening. But the other issues, for example, the congestion, for example. See, I mean, no one addresses those kind of things. The congestion and the encroachment, for example, that you do not require technology. You do not require BS6. The burning of solid waste, for example. I mean, what a technologist can do, I mean, it is just larger management and the issues, the Gajipur landside. I mean, that is a very important source of volatile organic compounds, actually. So these things are sometimes, well, I would again say the industry is easy to sort of, go for, but there are many other issues which we need to tackle, and then only we'll have some, significant improvement in the air quality. So things are happening, but there are other issues which requires more attention, which are fugitive, non-point in nature, actually.
Dr. Sharma, I mean, definitely there are many kind of critical issues on the governance and the institutional aspect, something about airshed management and regional level management of air quality, Dr. Shah kind of briefly referred to as well. And definitely important to the reforms that we urgently require. So now, I think we'll move to kind of questions from the audience. I'm going to request Jyoti, if you could come on and ask your questions, and if you could also just kind of mention who you would like to respond to your question. You're on mute, Jyoti, right now.
Okay, is this, can you hear me now? Okay, great. So I had a couple of questions. One, of course, was, and I'd be happy for Dr. Sharma and Dr. Shah to address this one, is I actually, as somebody from civil society, originally a complete non-expert, but somebody who's affected deeply by pollution in many ways, I'd like to understand, when we have WHO global standards out there, number one, why are our standards not as ambitious, and why, just trying to understand why it is that each country has to have different standards that don't, all of them seem to be, I don't see any standards that are more stringent than WHO. So what I'm trying to find out is why we don't have similar standards that I understand we're not being able to meet even the current standards, but at least to have a goal, because we know this is a critical issue. And the second question, if I may just add that right away, is, the CPCB is a body that looks at, it monitors as well as is supposed to control. And those two there's an inherent conflict in that itself. And I feel that, in some ways, perhaps that could be one of the reasons why there isn't enough trust sometimes in some of the numbers, data that is, that some of us get from CPCB. Suddenly, post-Diwali, a lot of times some monitors inexplicably stop working, and we don't know why that happens. And this happens consistently over the last 3 or 4 years that we have seen. And then the last thing that I really want to say, and I really would like, this is actually the main crux of it, awareness seems to have become an issue, something that it's become the job of civil society and media to sort of talk about pollution, and then it becomes a seasonal thing. I think one of the things the government did really very well during COVID and its pandemic time was to literally, we couldn't pick up our phones without getting the COVID messages. So, the awareness about a public health emergency was out there for everyone to see. And in a country of, 1.4 billion people, I think that was done very well. And I don't see that kind of urgency in spreading awareness to everybody about air pollution. It really should be part of the government's job itself to, have enough information in simple, understandable, accessible ways for people to understand, whether it's a bus driver or your traffic policeman, or even these young students these days who are standing at traffic lights holding placards in Delhi saying, stop idling, etc. So those are the really three issues that I'd like to address.
So I think the first one was certainly for Dr. Shah. So Dr. Shah, do you want to?
WHO standards are an aspiration. So in that sense, we've got to be careful about the distinction between standard setting and the actual task of pollution control, which is about using state power, threatening state violence against private persons so as to achieve pollution control. So as long as we'll keep our heads about these two separate. And then you come to a number, which is what is the optimal level of pollution that is desired by a given society? And that answer can and should vary by location, because the costs of pollution control and the benefits from pollution control vary everywhere. And each society has to discover the efficient level of pollution, which is where the marginal gains from pollution control are equally matched against the marginal damage that is caused by pollution. So we should not think that there is only one number, which is a WHO number, that should be applied everywhere. In fact, that number should be thought from scratch through the balance of politics in each place.
Prabhakaran, did you want to respond, particularly with respect to Jyoti's point on communication and reaching out and awareness?
Yeah, Shibani, I mean, I think Jyoti's point also about, if I can take a minute about the
Sure, please.
Itself.
Of course.
WHO guidelines, so far as a country like India is concerned, they are aspirational. We cannot, if we go by the WHO guidelines, 99% of our districts will be in the danger level. And even with just the NCAP cities, the non-attainment cities, we haven't gotten where we need to. So we really need a different set of standards for India, and we have to get there first. To the interim levels are what is important for us. I mean, WHO guidelines beyond reach. I think we first need to get to our own, permissible levels for India. And in terms of, advocacy around air pollution, I think there's a lot being done by different groups of people, including the Ministry of Health. I think last year, on the International Clean Air Day for Blue Skies, we helped them release with WHO India office a lot of advocacy material, IEC material, on impacts of air pollution on health for women, rural women, for children, this year for traffic police, for municipal workers. And that has been taken down to the states, and disseminated widely by the state officials. So apart from that, there are very many groups who have this awareness. We ourselves are doing an initiative where we are putting up these TV monitors in hospitals, so that the doctors become advocates as well of air pollution levels in their regions. So we have this in the waiting rooms of the hospitals. We have these air quality information that is being shown along with impacts on health. So we have that in English, in Hindi, in the regional languages as well. So the people, while they're sitting and their appointments, are actually looking at what the air quality is in their region, and then also learning about impacts it has on health. So we work a lot with the health sector, with health actors, actually, to become the voices for and advocates for environmental. So I think there's a good amount fair. I would think it unfair to say that there's not enough of awareness. I think it's happening through different groups, but there's scope to do a lot more.
Thank you, Dr. Sharma. There's a question for you from the audience, from Swagata De, that currently the health advisory is attached to the AQI, and whether that's helpful, and shouldn't the advisory be actually based on the pollutant profile, like PM10, and specifically what makes up PM10?
See, definitely, different pollutants have different impacts. But what is happening is that, those things are to give those detailed information onto the website. So that was thought to be, like, for example, we take the carbon monoxide, what it can happen and that sort of thing. That is very detailed information. So it is a very summarized information, because we think the standards, what we have, will have the very minimal impact. So achievement of the standard versus how if the AQI goes up, And so how would the people in general, larger population would be affected? So it is a broader advisory rather than specific to a group or specific to the pollutant actually. So to have the information in a limited sense that was given. And sometimes, what happens, this could also be possible that the two pollutants, both in a synergistic sense, there might be something different. And when we were developing this air quality index, which was developed right here with the students, and the software and all was sort of developed. So it was thought to start with, let's have this minimal information. But maybe, in the next revision, we can have a little bit more information. Once you click to, one of the sites or click to, those tables that you see on the end of the AQI, that you can get more information. But I think it should go out as a broad information to the people, but then specificities can be added to it. That is certainly a good idea. But that should be, again, very scientific rather than, which we, not from anywhere else. But if quickly, I can also respond to the WHO guidelines. I'm telling you, the new guidelines of WHO, even many developed countries will struggle to achieve these guidelines. And Indian condition, you see, apart from the emissions that we have, unfortunately, in the northern India, that our meteorology, our conditions, geographical conditions, Ganga basin, we call it Gangetic plain, but essentially it's a valley. On the left-hand side, there's Himalayas. We can't disperse, naturally there's no dispersion. So these are the challenges. And we have very high, urban agglomeration at one place. Therefore, these are the challenges. And, for example, rainfall, we have a typical rainfall in the rainy season, not throughout the year. So these are the challenges, but in no sense that they're a alibi that we should not improve our air quality. So, challenges in India are, like for any other problem, are enormous actually. So these are the difficult issues. But I think we got to do something. Last point I'll say is that when WHO has come up with a small document that how to protect yourself from the pollution. If suppose the pollution is high there, well, something cannot be done immediately, but something individuals can do to avoid that exposure. So those things are there. WHO has come up with a very nice document on that. So these are the points.
Great. Polash, can we have you on?
Sure. Thanks, Shubhani. I'm sorry I'm not on camera, but my question was very straightforward. It was just that there seems to be a dual approach right now with health and mitigation as far as air quality is concerned. Like Bhargav's presentation spoke of mainstreaming health into policymaking. So my particular question is, how can we do that at the implementation stage, not just with state pollution control boards, but also as a wider frame across policymaking, decision making, and especially at the ULB level.
Dr. Prabhakaran, would you like to take that one, or anyone else?
So, I just like to want to Polash by saying I think he knows, and I know as well, it's different ministries doing their things in verticals. I think there's a lot of, so the Ministry of Housing and Urban Affairs definitely works with the ULBs, and they have they have something called the Climate Smart Assessment, Climate Smart Cities Assessment Framework, and where air pollution is an important domain of action for cities. And within that, they're supposed to address both their city air action plans as well as their monitoring framework. So that's happening within that ministry. The Environment Ministry is doing its own thing. The Health Ministry is doing, its own thing. They're spreading awareness on the impacts on health, but they're also doing a bunch of studies on the impacts of air pollution on health. So I think it takes at the ground level implementation. I think the officials are getting confused at the ground level. What are they? Because they're supposed to respond to every ministry, every department that is acting, asking them to take action. So I think a lot of coordination and empowering those city level officials at the ULB level, Polash, I think is so important, because the instructions to them are coming from so many different directions. They end up getting confused, and oftentimes they have a regular day job to do apart from spreading awareness on air pollution or addressing things on their own. There's a lot to do in capacity building. There's a lot to do in terms of empowering them, in terms of resources as well. That's just my initial thoughts, but I'm sure there are other thoughts as well in the panel.
Dr. Shah, I just had a question for you from the audience. Do you, from your experience in other sectors, could give us some examples of periodic reviews, technical, scientific periodic reviews that take place, which are then able to kind of feed into the policy making, because that would be really good for us to look at as we consider this process.
So first of all, I want to worry about the words you used.
Sorry.
Scientific change.
Okay.
So the efficient level of pollution is the place where the marginal cost of pollution is equal to the marginal benefit from pollution. So technological advances in the cost of pollution control will influence that, as will the changes in the cost. Technological advances in the cost of pollution control versus changes in the cost to society of the pollution. So bluntly, economic growth means that the people demand cleaner air. So you've got to constantly rethink, am I at the efficient point? Because the extent of poverty in the country is changing. As the country becomes richer, we demand cleaner air and cleaner water and so on. There are a couple of frameworks that are well established in other sectors. In the case of the Monetary Policy Committee that votes to choose the short-term interest rate of the economy, the law codifies that it meets 4 times a year. Okay, so there's a whole process that it's a 3-day meeting. On day 1, the experts do presentations to the MPC. On day 2, the MPC debates within itself. And on day 3, the MPC votes. So this is the structured machinery through which 4 times a year MPCs come out with decisions. There are other countries in which it is 6 times a year. The second kind of idea that has been put into some draft laws, which is prevalent elsewhere in the world but is not there in India, is to have sunset clauses on regulations, so that whatever be the machinery of state power that was used to do coercion of the people has an expiry date attached to it, because of the sort of stuff I was saying a moment ago, that it is in the very nature of every human society that technological change improves the opportunities for pollution control and economic prosperity increases the costs of pollution. So every few years one needs to rethink that, now what's my efficient point? And for example, what I would suggest is that in the primary law there needs to be a clause that the coercive machinery will be rethought from scratch every 2 years, every 3 years, whatever.
Right. Okay. So we have time for a few more, maybe one question. Sorry, there's electricity is gone, but I'm assuming I can be heard still. So there's a question from Mr. Ramakrishna, who is saying, again, Dr. Shah, to you, when it comes to matters like regulating air pollution through standards, we invoke precautionary principle rather than marginal cost principle, as there's a lot of uncertainty on the types of impacts, quantum of damages, and their cost. Does the emphasis on cost mean we do know the costs with greater certainty now?
Yeah, what you said is exactly correct. That when you think about climate change, a very big factor in our mind should be the uncertainty, that we really don't know. We have very poor modeling capabilities to understand climate change. My personal opinion is that in the case of air quality, particularly over the last 20 years, the uncertainty on the health impacts of air quality is now significantly lower. So I feel we're on stronger ground on understanding the adverse impact upon health of bad air quality today. We still don't know a whole lot about the cost to society of pollution control. So if you think of a menu of choices of pollution control and you try to go quantify what is the cost paid by society by adopting a control measure X, it seems to me that that literature is very nascent in India today. Your point is well taken, that we need to not have the hubris of thinking we figured it out. I was in that hubristic mode where I was being in a textbook and thinking that we know the marginal cost and we know the marginal gain, and you have to find the middle point.
Right. Okay. So we have a few minutes left. Dr. Sharma, I was wondering if you had any closing comments, and also there are a few questions with regard to technical solutions like smog towers that have come up, and if you could just kind of fold in if you thought those were those have been found to be effective, these kind of technical solutions have been found to be effective or not? Just in your closing remarks.
See, generally, the pollution, as we learn and as we teach, is a pollution control at the source is the best option. That is always there. But then what we call such things are called the receptor remediation. Source remediation is always better, required, desired, and that's how it should be. But some special conditions may require what we call as a receptor remediation. So we will have to look at the local condition, and of course the smoke towers, I think they started with some initial understanding, initial R&D kind of thing. So there's some data are still being collected, and then I'm sure we would understand how much is the control and how far is the you have the battery air quality. So that issue would be sort of will be clear. So apart from the last thing, what I have said is that, well, airshed approach, we have to work at 3 levels. We have to work at the local level, including ULBs. That city has to do what best it can do. I always, coin the term KYC, know your city. That's very important. And second thing is the regional level. That's what is the airshed basis. And third thing, we have to work at the national level. So these 3 things have to work together, and they have to gel well. And then we can certainly have a better air quality than what we have today. Thank you.
Thank you, Dr. Sharma. Dr. Prabhakaran, any final words?
I think I agree with what Dr. Sharma said, and also to say that I think the standard setting process is obviously not an easy journey, but I think we certainly all agree that it requires a bunch of different people sitting together, and it certainly requires public consultation in a very, very inclusive manner, not at the end of the journey, but right through the process. And I think it's important to bring that public lens as well into the conversation.
Thank you so much. And Dr. Shah, any final words from you?
Thank you very much for having me. I just have one comment on the data and the advocacy. It's good to always focus on what's the market failure, what's the role for the state. There is a public good of data. And so there is great value when the government will make data. And that data should be released through an open API. After that, it should really be up to civil society to consume that data and put it to 1,000 different uses and innovate in presentation of the data and so on. So for an analogy, what you really want the Survey of India to do is to survey the country and release the database. Then a variety of private actors, whether it's OpenStreetMaps or Google Maps or whatever, will use that data and present maps nicely. So that's the nice way to think of the handoff between public and private. The job of the state is to do market failure. One of the 4 categories of market failure is public goods. So if something is non-rival and non-excludable, that is the work of the state.
Well, thank you so much, Dr. Shah, Dr. Sharma, and Dr. Prabhakaran. This is a really lively discussion. And as Bhargav and I both mentioned, this is really just the start. We're hoping this would be the starting of a much more constructive engagement with all stakeholders. And I'm conscious not to call us experts or technocrats of any way. But also Dr. Sharma, who is part of the committee, we do hope that, many of us can continue this engagement and contribute to the process to make life easier and maybe more difficult for you. Thank you so much, everyone. As I said earlier, just a final pitch for an event for which details will be circulated very soon. Next week on 15 December, Wednesday, on reforming air quality governance in India. Thank you so much, everyone.
Thanks.
Thank you.
Thank you, Shwani.